Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a dental receptionist. Now read the question.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we'd get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
OK, we'll book you in for tomorrow morning at 10.
Question 26. You hear part of a presentation to nursing staff about an extension to visiting hours. Now read the question.
Now, you'll have received the survey asking your opinion about extending visiting hours, and doubtless you've got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on patient recovery rates of increased contact with loved ones. This isn't in question, but of course things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough on your plate without having to worry about extra demands from visitors. Well, we've carefully planned things to prevent you being overrun with queries, interruptions and so on. Visitors will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
Question 27. You hear a surgeon discussing a patient with a nurse in the recovery ward. Now read the question.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
OK. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems OK, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
OK, I'll make sure a report to watch out for hypocalcemia is passed on.
OK, if you need me, call me.
Question 28. You hear a chiropractor briefing a colleague about a patient called Ryan. Now read the question.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time, how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
Question 29. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. Now read the question.
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risks, maybe an hour or two. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Question 30. You hear a surgeon talking to a patient who's just had a knee operation. Now read the question.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Good.
Give it 4 months before you put any serious impact on it, though.
4 months. After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
That is the end of Part B.